Okay, let me get this down. I'm a little bit shorter than Colby and Dr. Stack. But thank you all for asking me to speak, for allowing us to come and get together like this. This is just wonderful to see everybody out and coming for the same purpose. So, as he said, my name is Ashley Webb. I'm the System Diabetes Education Coordinator for ARH. And my topic today is food as medicine. And I'm going to specifically talk about food as medicine with diabetes. So, we know that food as medicine has been around the concept for a long time. It actually goes all the way back to Hippocrates. Said, "Let food be thy medicine, and medicine be thy food." So, we just want to make sure that we get this out so that more people than just us knows this. We want to make sure that our patients understands, the community understands the importance and how that food as medicine can help our bodies. So, what is food as medicine? It's the concept of using nutritional choices to prevent and manage chronic diseases as well as improve our overall health. And food that we consume can have a giant impact on our overall well-being. It plays a vital role in maintaining our health and well-being. It serves as a form of medicine by providing the nutrients, the vitamins, and the minerals that our body needs to function every day. And food is remarkable. It sustains our life. We have to think, if we don't take in the nutrition, we're not going to be able to function. We're not going to be able to live. It fuels our body, and it has an impact on the way that our bodies perform. It's essential building blocks for our cells and our organs, influencing our energy levels, our immune system, and our overall well-being. So just from these statements, you know that what we take in affects our entire bodies from our head to our toes, and it prevents and manages various conditions. So diabetes being why we're here today, and one of the main focuses on our food as medicine. What we eat, we know this as clinicians, has an impact on our blood sugar levels, our insulin sensitivity, and our overall health for individuals with diabetes. That's why whenever we do our education, we spend the majority of our time talking about nutrition and what to eat, when to eat, how much to eat. A balanced diet focused on controlling carbohydrates, monitoring portion sizes, and choosing those low glycemic foods. That helps to stabilize the blood sugars and reduce the risk of complications. So there's a lot of challenges and barriers. That's why we're here today. If things were always well with diabetes, we wouldn't need to come together like this. But there's challenges and barriers that we're going to have to look into and focus on overcoming. So the lack of knowledge and misinformation. So a lot of the times our patients don't understand the importance of what they eat. Sometimes they eat for enjoyment and not the nutrition value of the food. Cultural and dietary preferences. We have to take into consideration a lot when we're educating our patients on what they have, what they eat, what they're used to eating every day within their families. So that's something that we really got to think about. Food as medicine, but we have to meet the patient where they are in their nutritional choices. Accessibility. We know that we have a lot of food deserts around in eastern Kentucky. There are transportation issues, lack of accessibility to grocery stores, fresh fruits and vegetables. So we need to work on those issues as well. And then socioeconomic disparities. Nutritious food is expensive. Junk food, the foods that aren't good for us, the foods that don't have nutritional value, those are cheap. Patients can go out and buy those much easier than paying for the nutritious foods that they actually need for their bodies. So we need to really address the food insecurities in Kentucky. And as you see here, with Feeding America is where I got these statistics from. You can see nationally that food insecurity is about 10.4%. Kentucky overall, 12.9%. And Eastern Kentucky, sadly, 20%. So 20% of Kentuckians are food insecure. And that is a staggering statistic to me. It's to look at the national level versus Eastern Kentucky, that speaks volumes. So what do we do about food insecurity with diabetes? How does it affect diabetes? We know that people that are food insecure are 2 to 3 more times as likely to develop diabetes than non-food insecurity communities. That goes along with the cost of nutritious food, and the calories that they get in aren't the ones that we actually want them to eat for their diabetes. People that already have diabetes and are food insecure most likely will have higher A1C levels, have higher risk of complications, hospitalizations, and poor mental health. So it just plays a role, all throughout our bodies if we have food insecurity, because if you're food insecure, you're worried about, do you pay the bills? Do you buy food? Do you buy cheaper food? Do you buy healthy foods? That's a lot of questions that patients in our area face. So I want to talk about some of the food improvements for food insecurity that ARH is doing. So the first talks about our farmers markets and voucher programs. We've been able to bring farmers markets to many of our hospitals across the system on site for our patients and our staff and the community to be able to have access to those fresh fruits and vegetables. We have a carrot cash program where we provide vouchers for kids to be able to go to the farmer's market, buy those fresh fruits and vegetables. That gives them a sense of pride in what they buy. And then diabetes dough. So that's for our diabetes patients that come to our support groups. And we give them vouchers where they take to the farmer's market and are able to buy fresh fruits and vegetables. And then we are partnered with the Kentucky Home Place for a senior produce voucher program in Harlan with a local produce vendor there. And then we also have employee gardens that are available at many ARH facilities that our employees have actually built themselves, and they've planted the seeds and harvested the vegetables right there at the facilities. We also are a member of the Food as Health Alliance Partners. Could somebody grab me a water? My mouth is like cotton all of a sudden. I'm sorry. Thank you very much. I want you to be able to understand what I'm saying here. Thank you. ARH is a founding partner in the Food as Health Alliance project that's through UK. We are committed to several efforts on in this partnership with the Food as Health Symposium, and we are committed to providing education to our providers and our communities for the nutrition related to food as medicine. We're also partnering with UK in Floyd and Perry counties to be able to provide food boxes directly to patients that qualify with either diabetes and or hypertension. And we're able to provide food boxes to them weekly for 12 weeks, delivered to their home through Instacart from Food City. We will track A1C, blood pressure, weight, and at the end of the program, we'll be able to report out those health outcomes. They will receive recipes with their food baskets to give them ideas of how to prepare the foods that they receive each week. They will receive fresh fruits and vegetables, protein, eggs every week. So that's a huge win for those patients. And then the Food as Medicine course through the American College of Lifestyle Medicine. We provide that free to our staff and our providers. And we have actually had 70 providers and staff complete this program already so that they are aware of the importance of food as medicine and to be able to talk to those patients that they see daily about the importance. We also have food pantries in the hospitals. We have one, our pilot program was in Morgan County. We ask the food insecurity questions. If they answer yes to any of those, then they receive a food box there at the hospital, and they're able to take this home and have those foods there available to them if they respond yes to any of the food insecure questions upon intake. And around 20 boxes have been distributed each month in Morgan County, and now this month we're actually expanding to the hospitals in Floyd County. We want this program to be spread across the system, just another way to help those patients that have food insecurities. Okay, our diabetes support group meetings. So this is my baby. I provide diabetes self-management education, but we've also started diabetes support group meetings. We started with 3 counties in Floyd, Johnson, and Pike counties. We've now expanded to 7 locations over this last year and a Zoom option. We have 4 new locations coming next year. But the biggest, I guess my proudest moment for our diabetes support groups is for I got ahead of myself. I'll give you some statistics first. We've expanded to 7 locations across 2 states. 218 individual participants have attended at least one diabetes support group over the last year. We've reached a total attendance of 739 in those 4 locations, adding in the January of 2024. Through the Palatine Foundation grant, we have been able to provide food bags to the participants in our Big Sandy regions each month. We've provided 439 meals per day to date, and I choose a diabetes-friendly recipe each month. And we have an extension agent, or in Hazard, at our Hazard location, we actually have a chef that comes and demonstrates the recipe for them right in front of them. They get to participate. They get tips, how to hold the knives, how to store foods. They see the recipe. They taste them there at the meeting. And then they go home with the recipe and the foods to prepare it at home. So we've also provided 153 free health screenings, including 140 A1C tests. You can see there in the picture that's our extension agent, Andy, in Floyd County. She's demonstrating the recipe, and underneath is an example of one of the month's ingredients that they took home with them. And then you can see the recipe, and we actually had a lady come up to me, I think 2 meetings ago, and said, I've tried so many more foods since I've been coming to the diabetes support group, and I like them than I have had at home. She said, I would not have tried these foods on my own, but now coming to the support group, I know that I can eat these healthy foods. So that was a big smile in my heart. With the A1C checks, we've had, and this is just in the Big Sandy region, 56% of our participants have had their A1C checked at least once. 74 of them, 74 of those that had their 74% of those that have had their A1C repeated actually have improved since they've been coming to the diabetes support group. And then I've had a participant that has came to 12 of the diabetes support group meetings. She's also attended individual and group diabetes self-management education, and she has lowered her A1C by 3.9 points. She has done very well and taken everything serious, but she attends the support group. She attends the diabetes self-management. She knows the importance of those healthy foods. So the future of food as medicine and diabetes. We want to increase patient and provider education. We have to get the word out to why it's important to eat your fruits and vegetables. We've heard that our entire lives, but what does it actually do? Collaborations. So those of us that are here today, we need to be able to work together and to improve the lives of our patients. That's our main goal, is to help patients with diabetes, to be able to work together and to pull our resources together for the better of the community. And food as medicine and diabetes provides a promising path towards improved health outcomes. But we have to get the word out. We have to get the importance of why that all of our patients need to take this seriously. So my challenge for you, stay informed. Take the course, the American College of Lifestyle Medicine course. Individualize your care. We know that what works for one person may not work for the next. We have to meet the patient where they are in their diabetes journey. And we have to prioritize education. So many patients out there have diabetes, but very few actually get education. We have to get the word out of why diabetes education is important for every patient and why we need those new diabetes educators. We want to empower and motivate. We have to get behind our patients and be a cheerleader for them and let them know exactly, you're doing great. Just keep going and doing what you're doing. Those collaborations that I was talking about, we've got to get together and pull our resources together. But we have to get also out in the community what resources are available. So, at our health fairs, at our, the community meetings, we have to let people know what exists in our regions. Because if they don't know, they can't take advantage of it. But thank you very much. That's what I've got.